Hi friends, I again invite you to Critical Care Communication series. Today I am going to speak about 10 salient points of ICU communication. Number 1. Establish a daily routine. Make sure that a particular time should be established when you are going to communicate with the family of a serious patient, so that the rapport will be made up, so that the next day at the same time family will be waiting for your briefing. Otherwise, if you make the time erratic, it might happen that expectation may not mismatch with the attendance. So make sure, even if it is 10 o'clock, 11 o'clock or 1 p.m., it should be a fixed time when you will be communicating with the family of a very sick patient. Number 2, appoint a single point of liaison or family liaison, so that there should be single point of contact. What happens normally, whenever attender is interacting with several persons regarding the same patient, let it be a nurse supervisor, let it be a nursing in charge, let it be a junior doctor, let it be a senior doctor or a consultant or a primary consultant, there occurs variation in their way of speech that usually confuses the patient. The message might be the same, but the body language and the way it is said by different personality might confuse the patient attenders. If patient is really sick and there is some sort of there are chances of some sort of communication gap, make sure that you sit together and explain the family in toto, so that patient will get a single version of the illness, so that it will be easy for further communication. Number 3, try to use simple non-medical language. What happens in our daily busy life, whenever we are counseling a patient attender, we tend to use lot of medical terminology like pyelonephritis, ventilator associated pneumonia, which might be very commonly used in our circuit, even in some medical families, but for a layman it usually confuses. This jargon create further terrorizing, more apprehensive in the long run. So make sure to use languages and words that is easily understood by them. Even local language will do wonders. So make sure you talk sense, you talk in a very simple non-medical language. And more importantly, if I speak about next point, it is about simply listening to them. We call it as proactive listening. Listen to them wholeheartedly without interruption. They might have some silly suggestions, might be some complex suggestion, some second opinions which they might have gathered overnight. Make sure to give your ears to them. Make sure you listen to them completely without interrupting before putting up suggestion. Next point, more importantly, schedule family meeting within 24 to 48 hours of admission. If patient is really sick and you know prognosis is extremely bad and there's a high likelihood of patient succumbing within coming 72 hours, it is very important that you schedule a family meeting within 24 to 48 hours along with your whole team, to make sure that you convey how serious you are about the patient and what are the plans of action. And after each counseling, verify what the family understood after the counseling. So whatever you have counseled, pause for a minute and let the attenders speak out what they have understood out of the discussion in their own language. That is very important to comprehend whether you have been very clear about your terms of action or not. And it is very important that you should be very honest about the prognosis. You can use Apache or SOFA just to show them what is happening around the world or India, but be very honest, give them certain practical feedbacks and what is going to happen in coming 24 to 48 hours. Patient may need ventilator, patient may need dialysis, patient may need angioplasty, whatever it is, be very honest and put them together, all the options that you have got in coming 24 to 48 hours. Apart from that, make sure to give a good psychological support. It is very important to support them psychologically while you are counseling them about very bad prognosis. To us, at the end of the day, he might be a patient, but for your heart, he is still a human being, he or she is still a human being who needs a lot of counseling, a human touch, maybe after every counseling discussion. More importantly, after all of this, make sure to debrief your team regarding whatever has been discussed, because whatever you have discussed with the family, the message is very clear to them. If the same messages are not conveyed to your team members, to the nurses, to the junior doctors, it might, the patient might get confused whenever they come next time to your ICU. So debrief your team members regarding whatever has been discussed in that. If you follow these salient points during ICU communication, I think it will be a cakewalk whenever you're working in the ICU. Thank you so much.